Um, as Gaya already mentioned, my name is Denise Lee. I'm an assistant professor here at Mount Sinai in New York in the Division of Surgical Oncology and Endocrine Surgery. And I'm delighted to speak about this interesting topic about how we use machine learning algorithms to help guide differential diagnosis. And so for this talk, I have no disclosures to report. I just wanted to divide it up briefly into just reviewing kind of just the very basic level, what actually is machine learning and how does it apply with artificial intelligence in order to have sort of a basis for understanding the application of how we use machine learning methodologies for establishing differential diagnoses, especially for surgical oncology malignancies, and I'll specifically be going over thyroid cancer. So as we know, artificial intelligence is a very broad topic. When we think about definitions, there are variable definitions of it, but we consider it as really the study of algorithms that give machines the ability to reason and perform cognitive functions, such as problem solving, object and word recognition, decision making, etc. So when we break this definition down, we're really thinking about algorithms. So that's what machine learning algorithms are. And then we're training them to be able to perform these cognitive functions and to think like a human being and make decision-making processes just like a human being. So when we think about a human, what are the sort of different senses that we use to interact with the world around us? So we use things like we have sight, we have touch, hearing, and speech. And so when we replace a human with a machine, we get this different subfields of AI. So with sight, we have the field of computer vision, and with touch, we have robotics, and with speech and hearing, together we have the field of natural language processing. So artificial intelligence, very big, broad topic. When we think about machine learning, machine learning is really just a subset within artificial intelligence. So machine learning is a field, it's a study of algorithms, statistical models that use computer programs to perform specific tasks without requiring explicit human instructions. So it enables machines to learn to make predictions by recognizing patterns on especially large amounts of data. And there are three different subtypes, as we know. So there's supervised, unsupervised, and reinforcement learning. And then just to describe briefly these different subtypes and how they can be utilized and how they're actually utilized. So with supervised learning, something that's often used for prediction, so that it requires two steps. The first step is really just training the algorithm using human labeled data, as we know. So we take a human being, takes all this different labeled data, so all this training data of cats, and then it learns to recognize the picture of a cat versus not a cat. And then we have the algorithm that can then go and, and infer a function from the actual training data itself. So then the next thing we have is then we take unlabeled data, and then we input it into the machine learning algorithm.
What we have found.
Oh, sorry. So we take the unlabeled data, and then we use the algorithm that was already trained on all this human labeled data, and then that's able to further help us to discriminate and differentiate between cat versus essentially not a cat. So supervised learning is very useful because it helps us to classify images using very large training data sets that have already been labeled by human beings. When we think about unsupervised learning, it's slightly different. We have lots of unlabeled data. We input it into a machine learning algorithm that can then group the data, images or whatnot, according to patterns that are subtle that it detects. So then we are then able as a human being to go back and to identify the patterns that the machine learning algorithm has recognized as either, for example, melanoma versus not melanoma. So unsupervised learning is very useful because it can help us to identify these very subtle patterns in large data sets that are otherwise imperceptible to the human eye in manual analysis. And then, of course, there's the reinforcement learning, and the easiest way to kind of, easiest example for this is really self-driving cars. So self-driving car, has its own algorithm that's learning from its own mistakes and its own successes. So for example, if you go right, if you're driving, you go right, you might hit that car. If you go left, you might hit the truck. But if the automobile continues to go straight, it'll avoid any accidents. And so it continues to engage in that behavior. So reinforcement learns by improving, by learning from its own successes and mistakes without requiring human supervision. So deep learning is also a term that we use often. It's really just a predominant algorithm that's used in machine learning. It's used especially, as we know, for image analysis. So machine learning has various different methodologies that are used. So in supervised learning, there's random forest, logistic regression, support vector machine, et cetera. Unsupervised learning, principal component analysis, reinforcement learning, value function iteration. So deep learning is just a methodology that can be utilized in all different subtypes of machine learning. And so it engages really artificial neural networks, which extracts hierarchies of features from all of the input data and images that are processed. And so it can achieve very high degrees of accuracy by training large amounts of data. So, for example, if you're thinking about thyroid ultrasound images and you have hundreds or thousands of thyroid nodule images, you input it into some sort of artificial neural network, a convolutional neural network, and within each layer, it kind of extracts different and more advanced features so that it can ultimately come out with a prediction of benign versus malignant, for example. So now with this very, kind of basic understanding of machine learning methodologies, how can we actually apply this for establishing differential diagnoses? And so when we think about surgical oncology, a lot of what we can be doing, what in our field in endocrine surgery, what has been the focus is looking at thyroid cancer. And so I just wanted to go over sort of how and what our field has been doing regarding using machine learning methodologies for discriminating thyroid cancer, benign versus malignant. And so our evaluation for thyroid cancer, of course, starts with the patient. So we identify thyroid nodules. And then our diagnostic workup for thyroid nodules, as we all know, of course, starts with the history and physical. And this is how, a medical practitioner goes through and thinks about diagnosis. Next step is everyone gets an ultrasound to better characterize the nodule and differentiate it. Then those that are suspicious undergo fine needle aspiration biopsy. And then we discriminate those that are benign, and we can observe those. Malignant, we operate, of course. And indeterminate nodules, we either pursue molecular testing to further risk stratify them, we repeat the biopsy, or we just take patients to the OR and do a diagnostic lobectomy. So the fields or the areas that have been kind of ripe for research using machine learning technology or machine learning methodologies has really been in the field of looking at radiology and pathology, or specifically cytopathology. So the problem with ultrasound features and looking at thyroid nodules is that the features are very complex, and their characteristics that are common to both benign and malignant nodules. So this just makes manual analysis very difficult. Reporting thyroid nodule characteristics is very highly operator dependent. So a radiologist might interpret it differently than the endocrinologist versus the surgeon. And so this variability in interpretation of ultrasounds can be a little bit confusing, and it can lead to inconsistent recommendations for whether or not one should undergo an FNA biopsy. And as we also know, many patients have multiple nodules, and it's very time intensive for radiologists to be reviewing all these nodules and characterizing them. So there are also hopefully ways to augment their workflow. So the premise is largely, can we train these machine learning algorithms to be able to interpret ultrasounds as well as a radiologist? So we think about all these ultrasound images. Traditionally in the United States, we have reporting systems that are developed by the American College of Radiology called the TIRAD system. And we also use the American Thyroid Association guidelines for also describing thyroid ultrasound images. And then they describe them as either malignant or benign. And then we want to see if we can replace the radiologist with or not replace, but to augment the radiologist with, as we know, with machine learning algorithms. So just reviewing some of the work that's been done in the field of at least ultrasound. This study that was published in the Journal of American College of Radiology in 2019, it was just a review of all the studies that have been published in this field before January of 2019 that applied some sort of deep learning methodology to thyroid ultrasound diagnosis. And at the time, in 2019, just a few years ago, only 8 studies that had been published identifying, or that they identified, that had used some sort of machine learning or deep learning techniques for thyroid nodule diagnosis. So they found that most studies used supervised learning and convolutional neural networks in order to predict malignant versus benign nodules. This study that was published from a group at Icahn University is an example of one of these types of work. So this group developed a machine learning algorithm that can diagnose, the whole purpose was to diagnose malignant from benign. And so they had a training set of over 1,200 nodules, and they had a test set of over 800. And so they generated 9 different machine learning models to identify which one was actually the most predictive of being able to discriminate between benign versus malignant. And they found that their best performing algorithm was the random forest classifier with the highest AUC. And unsurprisingly, by adding data, additional data, such as real-time elastography, in addition to just image and conventional ultrasound characteristics, it really helped to better differentiate benign from malignant nodules. They also found that their random forest classifier performed better than radiologists in being able to accurately identify malignant nodules. This next study from Duke was actually kind of interesting because it took things one step further. So rather than just discriminating first and differentiating and benign from malignant, their question was whether or not they can also develop an algorithm that can predict and advise the next step about whether or not they should undergo an FNA biopsy, the actual nodule. So they had a training set of over 1,200 nodules, and they trained their deep learning algorithms to detect thyroid nodules, predict malignancy, and risk stratify. And they had a test set of about 99 nodules. And so what they wanted to do was compare the performance of their deep learning algorithm with a group of expert radiologists who had participated in the development of the American College of Radiology TIRAD system, and then compare that to the performance of just a group of 9 radiologists who did not have any sort of specialty training in thyroid ultrasound. So looking at their study, they again compared the performance of the deep learning algorithm, the expert committee, and the group of general radiologists. And they found that in terms of how accurate they were with predicting malignancy, that they all performed fairly well, or at least fairly equivalent. So their AUCs were very close to each other. And they found essentially that the deep learning algorithm was as good as the expert committee and a little bit better than the radiologists. In terms of being able to accurately recommend an FNA biopsy when the nodules were actually malignant, so what was their sensitivity? The deep learning algorithm was as good as the expert committee and a little bit better than the general radiologists for recommending go ahead and do the biopsy when the lesion was malignant. And so the specificity is actually pretty low for all groups, which is not surprising because we end up biopsying a lot of nodules unnecessarily because we know that we're kind of concerned about them, so we end up biopsying a lot of benign nodules. So in terms of how good was the deep learning algorithm at not recommending an FNA biopsy when the lesion was actually benign, it was as good as the expert committee and again better than the radiologists in general. So the next step in our diagnostic workup for discriminating and differentiating benign from malignancy is, of course, doing the FNA biopsy. So as I've already described, suspicious nodules undergo an FNA. And so cytopathologists report FNA biopsy findings according to the internationally standardized Bethesda system for reporting thyroid cytopathology. And so there's 6 different diagnostic categories. And each diagnostic category is given a risk of malignancy as well as management recommendations. Of course, FNA biopsies are not perfect. 15 to 30% of biopsies will actually. So, because of that, we often have a lot of patients who have permanent biopsies to the operating room, and as it turns out, only about a quarter of them end up being malignant when we take them out. So we're doing a lot of operations, to be perfectly honest, on patients with benign disease. At least in the United States, we further risk stratify patients by doing molecular testing oftentimes in patients who have indeterminate biopsies, but this can be rather costly with variable sensitivity and specificity amongst the commercially available tests. So it's possible that an AI-powered algorithm can be a tool to help better discriminate benign and malignant nodules on cytopathology and make this differential diagnosis even more accurate. So again, the same idea is, can we take all these cytopathology images, and we see the difference here between a benign and a malignant group of follicular cells, and then replace, or augment the work of a cytopathologist to be able to risk stratify patients. So just an example of one group who was looking at this in the field of pathology, this a group from Duke published a study in cancer cytopathology in 2020, and they developed a machine learning algorithm to be able to predict malignancy and finding the aspiration biopsies using whole slide images. And they had about a training set of about almost 800 whole slide images, and then they had a test set of about a little over 100 FNA samples. And so for their methodology, they first developed a screening machine learning algorithm because they had to first figure out a way to identify the follicular groups on a whole slide image, which is kind of a bit tricky because for FNA aspirates, there's only small amounts of area that actually have the follicular cells of interest, and the rest of it is just empty space on the slide. And the next step was then to develop a classifier machine learning algorithm that was then able to actually distinguish benign from malignancy, and also identify the Bethesda category. And this is just an example of kind of what an aspirate kind of smear looks like. And so they found that in their test set of about 109 patients, the machine learning algorithm was had very good sensitivity and specificity. Their AUC of their machine learning algorithm compared to their cytopathologist was actually fairly equivalent as well. So of course there are problems with, and limitations for a thyroid image analysis, either with cytopathology or with ultrasound imaging. And this is kind of one of the limitations that we have for applying machine learning algorithms for at least in thyroid cancer diagnosis. So one of the limitations, of course, is just the data set itself. As we know, many machine learning algorithms that we train presently, are evaluated on limited single data sets in a single center. And for ultrasound, we can just be using the same ultrasound device. So how is this potentially generalizable, this data and these findings? So there's also limitations to the imaging themselves. So thyroid nodules, of course, are three-dimensional structures, and current machine learning models only use 2D cross-sectional imaging to make their predictions. And as we know, there's also black box problem when we're doing any sort of deep learning. So the algorithm finds the rules itself. It doesn't explain exactly how it came to make their decision-making process or their predictive analysis. And so for legal reasons, it may not be sufficient just to say that we have a very good predictive model that's very accurate if we can't explain how it came to that conclusion. So in the future, it's possible that we can improve generalizability of machine learning models with different methods of data augmentation. We can potentially build more transparent models to explain how and what they predict. Training models using three-dimensional data can also lead to more diagnostic accuracy. And very importantly, considering how we can protect patient privacy, because we utilize large amounts of data, how we can potentially increase accuracy of our algorithms, but also protect data privacy. There's many different ways that we can consider doing that with, certainly with synthetic data, federated learning, and other sort of techniques like that. So I thank you all for your attention. Again, thank you so much for inviting me to come speak today, and I welcome any questions.